this lecture. Okay. But we're going to be doing the vitamins and coenzymes lecture. I'm Hania Nizami, by the way, so I'm a PAL tutor, and it is a little bit of a long lecture. I tried to make it interactive and sort of made like fun mnemonics, hopefully. So hopefully that will like keep you engaged. I usually time myself, but I wasn't able to time myself for this one. But I'll try to focus more on the high yield stuff. And again, I'll be quizzing you guys throughout. So make sure that somebody's saying the sound is a bit not clear. Okay, is it better if I talk louder? Is that okay? Okay, so I'll just talk at this volume then. But yeah, I will be quizzing you guys throughout. So I can see the chat box. So make sure that you answer my questions in the chat box. And if you guys have any questions throughout the lecture, you can put them there as well. And I will try to clarify them as we go throughout. And then I can also clarify them at the end, obviously. Okay, so let's start. Okay, yeah, so we're going to be going over two types of vitamins. Most of the vitamins in this lecture are going, or most of my emphasis is going to be on the fat-soluble vitamins. So those vitamins are A, D, E, and K. I'm going to be repeating that a lot, that the fat-soluble vitamins are A, D, E, and K, so that hopefully when you go into the exam, you'll be able to remember that A, D, E, and K are the fat-soluble. And the water ones are pretty easy. It's mostly going to be different types of B vitamins and then a very short slide on the C. We're going to go over what the deficiency of the vitamins, like what that can lead to, and a little bit also like about the toxicity. But I want you guys to mostly focus on the deficiency, and I'm going to emphasize on how this can clinically manifest. So for example, like how they might give you this in a question on the exam. And then at the very end, we're going to go over coenzymes. Okay, so this slide, I think the main thing that everything will kind of cover throughout the lecture, but the main thing that I want you guys to know is that vitamins, you only need them in a very small amount. And that's why they're called like micronutrients. And even though you only need them in a very small amount, it is important to note that I would argue that deficiencies are still more clinically relevant than toxicities are. And as we go on, I'm going to also clarify that like fat soluble vitamins, they're going to be able to be stored in your body in the tissues. And if you think about that, that kind of makes sense logically, right? Like if I have something that's fat soluble, it's not going to be able to stay in my blood, right? Because my blood is mostly water. And so it's going to have to find tissues where it can go in and it can stay. In contrast to water soluble vitamins, those are water soluble so they can stay in my blood because again, my blood is mostly water. And so because of that, if they're staying in my blood, they're more likely to be excreted in the urine. And therefore I need to keep replenishing water soluble vitamins in contrast to fat soluble vitamins, which can go into my tissues and stay over there. I'm going to repeat that again in the lecture, so don't worry if you didn't catch it this time. Okay, so like I said in the beginning, I'm going to say this again. There are 4 fat-soluble vitamins that you need to know. Hopefully you get this right in the exam because I've already said it 5 times. A, D, E, and K. We're going to, my voice is still not clear. Okay, I'm gonna change my mic to somebody saying. Okay, somebody's saying it is, so could like my assistant person, is my voice okay? Okay, people are saying it's clear. It's a bit choppy. Okay, I'm gonna keep it like this because I think majority of people are saying it's clear. And I'll try to enunciate as much as I can. Okay, but yeah, like I said, there are, okay, if it gets worse, I'll switch mics, so just tell me guys. But like I said before, there are 4 fat-soluble vitamins, A, D, E, and K. And then when we're talking about water-soluble, we'll mostly be focusing on the B vitamins. and I'll go a little bit into very briefly about vitamin C. Okay, I kind of already talked about this, but I'm just going to emphasize it again, just so that you guys can understand it conceptually. If I have my vitamins that are fat soluble, it doesn't make sense for them to stay in my blood because my blood is water soluble. And so instead, my fat soluble vitamins are going to go into fatty tissues. Some of them might also go to my liver, and they're going to be stored over there. And so because I have a storage mechanism for my fat soluble vitamins, I don't need to replenish them as often as I need to with my water soluble vitamins. Okay, so earlier I mentioned I have a little bit of like fun mnemonics for you. I'm going to tell you how, when I was in first year, how I memorized the things related to vitamin A. So I would, instead of saying vitamin A, I would sort of say it in an Australian accent, and I would go like vitamin I, or I don't know how to do an accent, but I would think about it in terms of vitamin I, like I as in like the organ in your body, the thing that you see with. And if I remembered vitamin I would be able to remember the clinical manifestations of it, which I will go into like more in the next slide. But before I get into that, we should go into what the different forms of vitamin A are. And just in case this comes up in an MCQ, I just want you guys to be able to recognize, in case you guys don't have a background in chemistry, that retinol ends with an "ol" because it's an alcohol, and retinal, which is another form of vitamin A, ends with "al" because it's an aldehyde. So if you see a question like that, just asking you which form of vitamin A is an aldehyde, you should be able to recognize that retinal, because it ends with "al", is an aldehyde. And then similar for retinol. So that's where their names come from. You guys should also be aware of, so you guys should be familiar with all four types of this. So retinol, retinal, retinoic acid, and beta carotene. I'm going to go into like in depth like each of these when I go into like the actual metabolism of vitamin A. But if you guys notice, the one that kind of sticks out the most is beta carotene. So this is another form of vitamin A. But if you notice, it comes from plants, and it could be pretty easy to guess. But the specific plant that you might associate with this is carrots, because it's called beta carotene. So carrots are very high in beta carotene, and that's why, I don't know if you guys were told this growing up, but I was always told that if you want your eyesight to get better, you should eat more carrots. And this is where that census sort of comes from. It's because if you eat carrots, the carrots have beta carotene, which can be converted into retinol, which is like sort of the active version of vitamin A. Although Dr. Raja does make a point down here that if we contrast the different forms of vitamin A, beta carotene is sort of the least effective form of taking in vitamin A. Instead, we want to try to get the other forms of vitamin A, like retinol, retinal, which are more associated with like meat. Okay, so like I said, I have like a little bit of a fun mnemonic. So I told you how I remember the first point in this functions of vitamin A, right? I told you that the way that I remember this is vitamin A, I make it sound like vitamin I in my head. And because of that, I'm going to remember that vitamin A is necessary for the visual cycle. And pretty much what that means is that if I don't have vitamin A, I can't make the necessary pigment to see properly. And so the patients are going to present with this thing called night blindness. It's not a literal blindness. It just means that when they try to go out at night, it's harder for them to see, and things look a lot darker than it does for normal people like us. But so that's why I remember the first part, visual cycle, because vitamin A sounds like vitamin I. The way that I remember spermatogenesis is that I literally just redrew the carrot and it made it look like a sperm. And then for the last part, or these two parts together, 2 and 4, I sort of combine them with this mnemonic over here. This guy is supposed to be a farmer, and as you can see, he's very sunburned, right? And so because of this, what I will remember is that I will think, okay, so the way that I walk through this is I think of vitamin A. Because I know that one of the forms of vitamin A is beta carotene, I start to think of carrots. And then I start to think of, okay, who grows carrots? And it's farmers, and they're very, very prone to sun damage. And the reason I want you to remember that is that if you remember this whole mnemonic over here of farmers and carrots, you'll remember sun damage and you'll start to think of the epithelium, or you'll start to think of skin cells. And that will help you remember this last point over here, which is that vitamin A is very important for your skin. And this is also going to come up because we're going to talk about what we use vitamin A for. But essentially what vitamin A does is that it can replace damaged skin and it can make new and healthier skin. The problem is that the skin is so new that if you go out to the sun for too long, you're very prone to getting sunburn. So the main idea that I'm trying to sell over here is that you should remember that vitamin A is very associated with skin, and you remember this from the sunburnt farmer. And you should also remember that it's very associated with the eye, and that's why you get night blindness. And exactly, somebody just asked, that's why we use retinol in skincare products. Exactly, and that's why on top of that, on top of using retinol for skincare products, they will tell you use retinol at night because they don't want you going out in the sun with your newly, made skin, and then you're going to get the sun damage. So hopefully that makes sense. So that's how I remember. Sort of the main three. Growth is, in my opinion, like less significant, but hopefully with this weird mnemonic, you'll be able to remember that vitamin A for the visual cycle because of eye. You'll be able to remember reproduction. Specifically, I really want to emphasize spermatogenesis because this gets a little bit confusing when I talk about this later. But remember, I'm specifically talking about spermatogenesis, and I made it look like a little sperm. And then also that vitamin A is needed to make new epithelial cells, for example, in your skin. Okay, so again, I told you guys that I would be quizzing you guys. So over here, you can see that I have like the breakdown or like the mechanism of vitamin A. And what I want you guys to tell me, okay, so we've kind of talked about a lot of this, right? Like I really emphasize on the point of skin. The point of vitamin A, or the indication of vitamin A, is that it replenishes my skin. And so if I have some sort of skin condition like psoriasis, which is like an autoimmune skin condition, or like severe acne, I can give the patient vitamin A on top of their skin. And what it's going to do is that it's going to, remove the bad skin, and it's going to replenish it with newly better skin. And I have a little bit of like a quiz over here. There's like the effects of vitamin A, and I've covered one of them up. And I really, really emphasized on it. The hint is that I said vitamin A. If you say it in an Australian accent, what does it sound like? So if you guys could just type in the chat box, what would be one of the main indications of vitamin A that I've covered over here? Okay, good. So I'm seeing a lot of visual cycle. And then exactly, do you remember the specific conditions that I talked about? Somebody said it, but if more people could say it. Night blindness. It's not a literal blindness. It just means that when they try to go out, it's harder for them to see. It looks more dark. But yeah, you guys are good. Okay. Okay, for this one, like I told you before, the component of carrots that makes them orange is literally beta carotene. And so as long as you remember that vitamin A is a carrot and that it's one of its forms is beta carotene, you should be able to get a decent amount of this. So for example, when it says yellow or when it says egg yolk, those are specifically because like beta carotene is literally like an orangish yellow pigment. Yeah, and then if you guys remember, I also mentioned that the dark green vegetables and the vegetable source of it is beta carotene, in contrast to more like animal source products, which would be more like retinol esters. So just to emphasize again, beta carotene comes from plants, then the other forms of vitamin A come from more like meat products. And if you guys remember, I also said it's better to get it from the meat side of things rather than the vegetable ones, because it's harder to convert vitamin A to its active form in the plant version. Okay, so over here, this is a diagram that is in the lecture. I think it's very like overwhelming. So I'm just going to, everything in green is sort of the simplified version and how I would approach this if I was memorizing this for an MCQ. So we already kind of covered one of the things on this, which is beta carotene. Where does that come from? It comes from my diet, and it comes specifically from vegetables. The other thing I want you to know is that if I need to transfer vitamin A in my body, I'm going to use retinol esters. And this should kind of make sense to you because I talked about vitamin A being a fat soluble vitamin, correct? And so if it's a fat soluble vitamin, that means that I need to make it more water soluble in order to transfer it in my blood. And if you guys aren't aware, esterification or adding an ester group to something is going to make it more water soluble. And so that should help you remember that retinol esters are the specific form of vitamin A that's used for transport. So just to recap, beta carotene is important because it comes from the diet, specifically vegetables. Retinol esters is important because it's the transport form of vitamin A. And then for the other two, remember how I said that vitamin A is really important for the eye. Like we've got that, I really drilled that into you. Specifically, the form that you should be aware of is 11-cis-retinal. Retinal, so it has to be an aldehyde. 11-cis-retinal is a specific form of vitamin A that is important for making the light pigment in your eye so that you can see better. And then lastly, I just want you guys to be aware of the fact that retinoic acid has a relationship with gene activation. And the reason that I'm bringing this up is that a lot of the times they will ask you like the mechanism of how something will work. So for example, in vitamin A, they might give you something that's related to gene activation, and then they might give you some other MCQ options related to like, does it activate an enzyme, for example. Okay, I'm just gonna switch mics. 1 second, sorry guys. Okay, I switched mics. Is that better, guys? Yeah? Okay, so I'll keep this. Hopefully you guys will be able to understand what I've said before this as well. Okay, I'll just summarize this slide very quickly, but it's just that 11-cis-retinal is the form that's specific for my eye. I have retinoic acid, which is important for gene activation. And again, if you see anything on an MCQ that's asking you about vitamin A and how does it act, you can cross out anything that has nothing to do with genes. If I see something about enzymes, I'm like, nope, that's not vitamin A. I know it has to do with gene activation. I know that beta carotene comes from my diet, and I know that retinol esters is the more water-soluble form of vitamin A, and that's used to transport vitamin A in my body. Okay, so I know I already tested on this concept, but I'm going to test it again. Dietary deficiency, I talked about something that can happen to your eyes, a condition. What is the name of that condition that's related to vitamin? Yes, night blindness. This comes up on an SCQ. I hope everybody gets this right. But we know vitamin A is related to the eyes, and that's so good. I also talked about how we know that vitamin A is also used to regenerate skin cells, and because of that, if I have a skin condition like acne or psoriasis, then I want to give them vitamin A. It's a topical treatment, so I'm literally just giving it on top of their skin so they can regenerate more skin cells. Something I didn't emphasize on much because I think this is a much more complicated topic is that you should be aware that vitamin A, you use it to treat promyelocytic leukemia. It's not something I can really explain because it's really complicated, but just try to be aware that vitamin A, you use it to treat promyelocytic anemia. Leukemia, sorry. Okay, so now we are talking about the toxicity, right? So something I really want to emphasize on this slide, you guys remember how when I was talking about the good side of vitamin A, like what is the use of vitamin A? I said it's good specifically for spermatogenesis. The reason I'm specifying spermatogenesis, and I showed you the carrot and I made it look like a little sperm, I want you guys to remember that it's not just good for reproduction in general. No, I want you to know specifically spermatogenesis, because I want you to think vitamin A is good for reproduction in males, not necessarily in females. So again, if I go back to the thing somebody said before, is that when somebody has acne, I might give them topical vitamin A. The thing is, if this person is a female, I need to take a social history and I need to ask them to make sure that they're not sexually active, because in case that they are, and in case that they get pregnant while they're on vitamin A treatment for their skin, vitamin A is incredibly teratogenic, which pretty much means that it can cause deformities in the baby. Exactly, somebody said it. So that's why I need to be really careful that if a female is taking this skin treatment, if they either have psoriasis or if they have acne, I need to make sure that either they're on contraceptives or that they're not aiming to get pregnant. Exactly, that's why we have a warning on them. So hopefully you guys remember that two things. Vitamin A is good for reproduction in males, because it's spermatogenesis. Not so much for females. I'm very scared of giving it to females because I need to make sure it's not going to cause problems for the baby. Okay, so we're done with vitamin A. Now we're tackling vitamin D. Yeah, vitamin D is a little interesting because compared to all the other vitamins, we can actually synthesize this from our own body, which is kind of cool. Like we kind of act like plants because it's the only time humans can convert sunlight into an organic molecule. And I'll go more into that mechanism later on. But yeah, it acts like a hormone, and I'm sure everybody's aware that vitamin D and sunlight are linked because, for example, if you guys know, over here in this region of the world, we have a high prevalence of vitamin D deficiency, and it's because it's so hot outside that nobody goes outside. We all stay inside. We don't get sunlight, and so we're all low on vitamin D. But yeah, I'll go more specifically into the mechanism. Okay, so for vitamin D, the way I feel like a lot of this gets so confusing. So the way that I simplify this in my head is I tell myself, okay, the end goal of whatever vitamin D is going to do is that it wants to get calcium into the blood. Whatever steps it's going to take, it is always going to aim to get calcium levels into the blood, raise serum calcium levels. And there's three main parts of the body that this is going to have an effect on. It's going to have effect on the bone, it's going to have effect on the kidney, and it's going to have an effect on the GI, right? So let's go into bone first. So I said, okay, I know for a fact vitamin D is related to calcium and it wants to raise calcium levels in the blood. What it's going to do to accomplish that is that it's going to go to the bone and it's going to signal to the bone to release the calcium that's inside the bone and bring it into the blood. And therefore, I'm raising my serum calcium levels. Okay, somebody asked what is PTH. I will go into that. It's this thing called parathyroid hormone. Essentially, I have an organ in my body. It's called my parathyroid, and it secretes this hormone, parathyroid hormone. What I need you to know, you don't need to know the details of the mechanism. What I need you to know is that vitamin D and parathyroid hormone, PTH, are best friends. They both have the same goal, which is to raise the serum calcium. As long as you remember that, I believe that should be enough. PTH is best friends with vitamin D. They both share the same goal, which is to raise serum calcium levels, to raise the calcium levels in my blood. Okay, and then let's go into the other effects of vitamin D. So I said one effect, which was bone growth. It's also going to have an effect on my GI. This, in my opinion, is the easiest one to understand. It literally is just going to increase the absorption of calcium from my GI tract. And if therefore the calcium is going to move from my GI tract to the blood. Remember I said that we want to move the calcium to the blood. And then the last thing is the kidney. And pretty much what's going to happen is that I'll try to show. Oh yeah, so pretty much what's going to happen is that if you guys understand what my kidneys do, my kidneys are responsible for making urine, right? Like the pee that leaves my body. So what vitamin D is going to do is that it's going to signal to the kidneys that, hey, you have calcium in your urine right now. I want to move that calcium from my urine back into my blood. Because remember, we said vitamin D's goal is to remove the calcium to the blood. So that's the three effects. It has effect on GI to increase calcium absorption, as an effect on bone to remove the calcium from the bone and move it into the blood. And the last effect is the kidney. It's going to tell the kidney, the calcium that's in the urine right now, I need you to move it back into the blood. And then we said that vitamin D and PTH are best friends. They both want calcium in the blood. Okay, so this is just a diagram representation. I don't think at this level, I'm not sure, but I don't think you need to know the specific things. At least that's not what I'm going to focus on. The only thing I want you to be aware of is that this form right over here, the one with the most complicated long name, 1,25-dihydroxy cholecalciferol, this is the active form, right? So essentially what we can see over here is that vitamin D is getting activated, and it's getting activated in three separate spots. First, we have my skin. We talked about sunlight. Sunlight is going to hit my skin. It's going to do the first step of activation of vitamin D. And then the precursor to vitamin D is going to go to my liver, and it's going to be further activated again. So the second step is in my liver. Then the third step is in my kidney. And when the vitamin D gets activated in my kidney, it's going to turn into the fully activated form, which is called 1,25-dihydroxy cholecalciferol. So I just want you guys to be aware of that. So the vitamin D, we have vitamin D in our body, but we need sunlight to activate it, and then it goes from the skin to the liver to the kidney until it's fully active, and it can do all these wonderful effects that we talked about, which is raising my serum calcium. And then as you can see over here, they even show you the three places that I talked about. So we talked about the bone, we're moving the calcium to the blood. We talked about the GI, we're moving the calcium in the lumen or from my diet into the blood. And we talked about my kidney, we're moving the calcium from the urine into my blood. It's always into my blood. And then somebody asked about parathyroid hormone. We can see it over here. It's just sort of like helping the vitamin D. I'm not going to go into calcitonin because I don't think you guys have covered that. Okay, so where do we get vitamin D from? We talked about, yes, we know, like we have sunlight, and from that sunlight, we can make vitamin D. We can also get it, you can pretty much summarize this entire thing from dairy products. And if you guys, the way that I remember this is that when I was young, and I would get injured a lot, people would tell me that like, oh, to make your bones stronger, you need to drink more milk. And the reason, or the reason people say that, she mentioned how boron resorption is inhibited by calcitonin. Okay, yeah, so I guess I will talk about it a little bit. I'll just tell you how I remember it. If you look at calcitonin, it's going to do the opposite effect of vitamin D. And the way that I memorize that, or the way that I remember, it's calcitonin in. So it's going to keep the calcium in the bone. So that's how I remember it. That's how I memorize that it inhibits bone resorption. So calcitonin in, because the calcium is in the bone. Don't you? Yeah, you also do get calcium from milk. That's a really good point. But I think the point of the slide is to also show you that you get calcium from milk, but you also get vitamin D from milk. And then what's margarine? Margarine is sort of like butter. It's just a different dairy product. So a lot of this is dairy products is the point that I'm trying to make. But I think something else that they kind of want you to be aware of is that the natural milk doesn't really have a lot of vitamin D. And so we have to do this thing called fortification, which is pretty much just like manually adding in more vitamin D into the milk. Okay, so the left side is factors that contribute to vitamin D deficiency, right? And I don't want you guys to memorize this, because as long as you understand the mechanism, you'll be able to sort of like rationalize your way through it. So let's look at the first point over here, dark skin, and the second point over here, lack of sunlight. Those two things are actually related, right? Because if I have less let's go through for lack of sunlight. If I have less sunlight, then that means that this very first step over here, this UV light that's coming from the sun, won't happen, and therefore I'm not activating my vitamin D. Yes, I have vitamin D in my skin. Yes, I have this precursor, but I'm not activating it, so I can't do the effects of it. Similarly, if I have melanin, melanin is a pigment, and what it does, and the reason that some people are darker than others is because they have more melanin. And if I have melanin, it's going to absorb this UV light. And the problem with that with vitamin D is that if I'm absorbing all of this UV light, the UV light can't go to the precursor of vitamin D, and therefore the UV light isn't activating my vitamin D. So now that you understand that mechanism, you'll now know that darker skin is related to vitamin D deficiency as well as lack of sunlight. These two things over here, breastfeeding without supplementation and use of non-fortified milk, those are again the same sort of concept. I think that's what she was trying to display with this previous slide. She's trying to show you that if you fortify the milk, if you manually or synthetically add in the vitamin D into the milk, I'm going to get a higher amount of vitamin D in my milk compared to if I don't fortify it. So all she's trying to tell you is that, one of the ways that you can overcome vitamin D deficiency is if you give them like milk, but specifically milk that has like manually added vitamin D. That's what fortification means. Okay, so these are the two conditions that you should be aware of with vitamin D. So we talked about vitamin D, we know it's related to the bones, right? But the way that I'm going to explain this is, again, it's a little bit complicated. But the way that I want you guys to remember this is we talked about how vitamin D, it has an effect on the GI tract. And it is going to increase the amount of calcium that's in my GI tract that goes and make it go into my blood. And it's going to raise my serum calcium. If we work on that concept, then we will understand that if I don't have vitamin D, I'm not absorbing as much calcium as I need to be. And therefore, there's not as much calcium in my blood. And if I don't have enough calcium in my blood, then that means that I can't mineralize my blood. I really want you guys to notice the word mineralize, because that is a dead giveaway that I'm talking about like rickets or osteomalacia. And it makes sense. Like, what are minerals? If you think of like mining or something, minerals are literally just, metal ions or whatever. So if I have demineralization, or if I don't have mineralization of my bone, all I'm saying is I don't have the calcium. I don't have enough calcium in my blood to add it into my bone. So again, if we follow that step by step, essentially what's happening is that if I don't have vitamin D, I can't absorb calcium. I can't absorb calcium. If I can't absorb calcium, the calcium levels in my blood are going to be low. If the calcium levels in my blood are going to be low, I can't add that calcium to my bone. I can't mineralize my bone with calcium. And so because of that, the bones are going to be very soft. And if it occurs in children, it's going to be called rickets. The very classical sign of rickets is bowing of the knees. If you see bowing of the knees in a test question, that's a dead giveaway that it's rickets. But if the vitamin D deficiency happens in adults, it's going to cause osteomalacia. And this is sort of like a softening of the bone, and it's demineralization, sorry. Okay, so we talked about osteomalacia. She put osteomalacia with this bowing of the knees. I think rickets is more associated with bowing of the knees, but at the very least, you should be able to be aware that vitamin D is associated with bowing of the knees, because I'm making my bones softer, and if I'm making my bones softer, they can't stand up straight anymore. They're going to be sort of more malleable because I'm not mineralizing my bone anymore. Okay, so on the right over here, I have, again, like a little quiz question or whatever for you. We talked about the three effects or the three organs that vitamin D affects. One of them I've already given to you. I've already told you that we know that vitamin D acts on the kidneys. There are two more that I've covered up. What are the two other effects, or what are the two other organs in our body that vitamin D acts on to raise serum calcium? Bones and GI, exactly. Resorption and increased absorption, exactly. increased bone resorption and increased absorption of calcium. Yep. Yeah, okay, everyone's getting it right. Bones and GI. All right, so I'm just going to cover that for you. So calcium mobilization and from bone. I notice a lot of people are using the word resorption. That's really good. It literally just means like breaking down the bone and freeing the calcium that's in the bone into the blood. And then, like we said, calcium absorption from the intestine. Okay, so now we are moving on to vitamin K. So the way that I remember the way that I memorize like the other forms of vitamin K, or like what they're called, is that in my head I try to make the Q sound like a K. So like phyloquinine kind of sounds like it's a K, not a Q. And so that would just help me in an MCQ so that I'm not confused when I see phyloquinine or menaquinine. I'm not thrown off because I know like, oh, that Q sounds like a K. And so I know that these are just other forms or other names of vitamin K. Something really interesting about vitamin K is that it's actually like the normal gut bacteria in our body that makes vitamin K. And this is going to be really important for when I talk about later what leads to those deficiencies. So just to emphasize again, vitamin K is made by the gut bacteria in our body. The other thing I want to talk about is, yeah, the vitamin K is for blood clotting. Again, the way that I remember that is I really emphasize the C sound, blood clotting. Okay, somebody asked a question. I just want to clarify this right now. What is the difference between absorption and resorption? I think what they're saying, okay, so if I go back to vitamin D over here, absorption always happens in the GI tract. It's when something in the food or whatever is absorbed into my bloodstream. I say it's absorption. GI tract to blood is absorption. Resorption is specific to my bones. It's when I'm breaking down the bones a little bit and freeing the calcium into the blood. So hopefully that helps. And then, okay, I don't want to confuse it. There's one more, so that's okay. Okay, yeah, sorry. Okay, I'm just going to jump back to vitamin K. Vitamin K, we said it has the Q sound. You're in your head, you're going to say the Q sounds like the K sound. And so when you see this on an MCQ, it's not going to throw you off. And then also, yes, we're going to think about it in clotting. Blood clotting, you're going to think of the K sound. It's going to help you remember that vitamin K is needed for blood clotting. And that should make sense. Oh, thank you, Kim. Anyways, deficiencies. Okay, yeah, so pretty much when we look at the deficiencies point right over here, if you understand the points of vitamin K that I just said, I just told you that vitamin K is made by the gut bacteria. If I have a premature baby or a very, very newborn baby, the problem is their body hasn't made that bacteria yet in their gut, in their GI system. And because it hasn't made that bacteria yet, the gut bacteria isn't present to make vitamin K. And so that's why in newborn infants, it's very, very important that I believe we give them an injection to make sure that they get vitamin K, because they don't have the gut bacteria to make vitamin K. Okay, sorry. And now so now that you understand that idea that vitamin K is made by my gut bacteria. If I have a very young baby, they might not have that gut bacteria. The other thing you also know is that vitamin K is related to blood clotting. So now let's think about this logically. If I believe I have a picture actually. Yeah, okay. If I don't have vitamin K, that means that I can't make a blood clot. If I can't make this clot right over here, what's going to happen is that I'm just going to keep bleeding. Exactly, I'm just going to bleed forever and forever. And that's called a hemorrhage, is when I have a bleeding, like an internal bleeding. So again, just to emphasize this, vitamin K, I need vitamin K to make these things over here, which are called clotting plaque. Okay, they're essential for clotting. And if I can't clot, then I'm just going to be constantly bleeding. And so now if I present you with a clinical scenario and it's a newborn infant and they're having a lot of bleeding problems, I know that you guys will know that that is a vitamin K deficiency because you know the whole mechanism behind that. Exactly. Okay, yeah, so that's why I added that image over here just for you guys to really remember that vitamin K is for blood clotting. Just 1 second. what about platelets? I don't know how much of this you guys have studied, but it has more to do with coagulation factors, which, okay, I don't want to say this for sure because I always get this mixed up. So I will get back to you on that. But it's more to do with coagulation factors rather than it. Yeah. Okay, I'm sorry. I just don't want to confuse it. I don't want to say something wrong. But just remember that it has to do with blood clots. I think that should be enough for your level. And even if there are platelets, it wouldn't be enough. You still need the vitamin K and the coagulation factors to prevent you. You'll learn more about that in third year. But yeah, so as you can see over here, I have my vitamin K. It's activating these things called like coagulation factors. It's activating them, right? And I need that activation in order to have my blood clot formation. Okay, another quiz time. So vitamin K deficiency. If you guys remember, there's one thing that I was talking about a lot, blood clotting. And so if I can't make a blood clot, what is one of the symptoms that I can get? Uncontrolled bleeding, hemorrhage, yes, bleeding. There we go. Okay, awesome. And I didn't talk about this a lot. It's a good thing I covered this because I low-key forgot to talk about it. But similar to my newborn concept, similar to the idea that if I have a newborn infant and they don't have the gut bacteria, I don't have the gut bacteria to make, people are already answering, yeah, I don't have the gut bacteria to make vitamin K. Similarly, if I give antibiotics, not antibodies, if I give somebody antibiotics, which is, you know, medication that's meant to kill bacteria, if I overprescribe them or if I give them too much antibiotics, I'm going to kill that gut bacteria. And so because of that, I don't have the gut bacteria to make vitamin K. And so again, this can lead to bleeding. And then we already talked about this. We give newborn infants vitamin K. They don't have the gut bacteria to make vitamin K, so we need to give it to them. It's not antibodies, it's antibiotics. Oh, these ones don't want to cover. Okay, well, you guys already know symptoms include bleeding or hemorrhage, secondary deficiencies, antibiotics. Sorry, I didn't uncover that one. Okay, somebody asked a really, really good question, and I'm really going to emphasize on this. So somebody asked, like, overdose of vitamin K in kids could cause hemorrhage as well. Okay, so this is where it gets a little bit confusing because I don't think you guys have the background for this at year one. But we talked about vitamin deficiency, and I told you vitamin K, blood clotting. If I don't have blood clotting, bleeding. Now, vitamin K toxicity is a little bit different. I'm not talking about bleeding anymore. I'm staying within the blood. I am talking about the blood, but I'm not talking about bleeding anymore. Instead, what happens with vitamin K toxicity, I'm going to damage my red blood cells. Literally, the vitamin K itself is going to damage the red blood cells. And because of that, I'm going to get this condition called hemolytic anemia. From the name, you can guess heme, red blood cells, lytic, breakdown, anemia just means low red blood cell count. So what's happening is that the vitamin K, if there's too much of it, only if there's too much of it, it's going to be toxic to my red blood cells and it's going to break them down. Okay, so this is different. It's not a bleeding problem. The blood is staying within my body. It is staying within the vessels. The red blood cells in my blood vessels, the red blood cells are being directly damaged. Okay, so if you see bleeding, that's deficiency. If you see something about red blood cell damage, then that's hemolytic anemia, which is going to just break down of red blood cells. And then something over here, jaundice. I don't know, I don't think you guys know this at this level, but if you break down red blood cells, one of the byproducts of an RBC, of a red blood cell, is this thing called like bilirubin, which can be converted, and it's this yellow pigment. Yes, it's yellow pigment, and so because of that, they're going to get yellow eyes. Okay, yeah, you guys took an itchy eye, so that's good. It should be prehepatic, but don't quote me on that. I will again check that as well. because again, it's about like increased red blood cell breakdown. Okay, we're done with, so we talked about the 3 out of 4 of the fat-soluble vitamins, A, D, E, and K. Well, A, D, K. Now we're on vitamin E. The way that I remember the other name for vitamin E is that I say this in a very obnoxious way, and I go tocopherol, tocopherol, and I'm like vitamin E, tocopherol, and it helps me remember, just so that on an MCQ I'm not thrown off when I see this other name for vitamin E. Okay, something else is that the way that we get vitamin E is through vegetable oils. And the way that I remember this is that vitamin E is very, like, it's not really a common deficiency. And the way that I remember that is that everybody likes oily food. We always have vegetable oils like in our diet. Everybody enjoys it. And so we're not really deficient in it usually. That's just how I remember it. Okay, so this slide, in my opinion, is very overwhelming. But again, I'm going to try to simplify it for you and tell you how I sort of memorize this. I relate everything on this slide to one concept, which is that in my head, vitamin E, I think of electrons. Vitamin E, I think of electrons. And as long as I remember vitamin E and electrons, I will be able to rationalize my way through each of these 3 steps. And so that's what I'm going to tell you about today. I'm going to start with what I think is the hardest one, which is protection of the polyunsaturated fatty acids. Like, what the heck does that even mean? So just as a little recap, I have things called saturated fatty acids and I have polyunsaturated fatty acids. You guys tell me, which of these is worse for your body? Is saturated fatty acids worse for you, or is polyunsaturated fatty acids? It's okay if you don't know. Worse for you. My question is worse for you. What is bad for you? Okay, I think some people said it wrong, which I'm glad that I'm, no, the one that's bad for you is saturated fatty acids. And I'm going to tell you why. And you're going to remember this when you go into the exam. Saturated fatty acid, what do you notice about the shape of this? It's so straight, right? Saturated fatty acid is literally just a straight line. And we know it is a fatty acid. The problem with this being such a linear structure is that it's so easy for my saturated fatty acids to stack up on top of each other. And if my fatty acids are stacking up on top of each other, that's going to make like a plaque, like a fatty deposition in my arteries. And so now, if you guys remember this, the saturated fatty acids are this straight set structure, aggregation. It is kind of like aggregation, yeah. And also, in case you guys don't remember, like saturated fatty acid, you're like, oh my God, is saturated fatty acid the crooked one or is it the straight one? Saturated means saturated with hydrogen, right? It means I have the maximum amount of hydrogen that I could possibly have. And so because of that, if I have all this hydrogen, there's no room for double bonds in my carbons. And so my structure has to be completely straight. Somebody said that you can think of saturated as straight as well. That works as well. But yeah, saturated fatty acid is bad for you. Why is it bad for you? Because if I have saturated fatty acids, they're straight, they're linear, they're going to stack on top of each other. I'm going to get these fatty deposits in my arteries. So I don't like fatty acids that stick up on each other. The other way that I also memorize this is that saturated fatty acids are found in solid foods. So like butter. We know butter is not good for us, right? And if you think about it, saturated fatty acids are sticking up on top of each other. They're becoming so compact that they're solid, versus polyunsaturated fatty acids, they're the crooked ones, right? Like they have double bonds, they have a lot of kinks in them. And so because of that, they're going to be liquid. So for example, like vegetable oil, it's a liquid because it's not as compact as compared to the saturated fatty. So polyunsaturated is the one that is better for you. So if you remember that concept, if you have that concept down clearly, you will be able to understand that adding a hydrogen to a fatty acid is not a good thing. If I add a hydrogen to my fatty acid, it's going to become the straight structure. And we said monounsaturated is like olive oil. I don't know the specific example of monounsaturated. I'm sorry. Somebody asked monounsaturated. I have no idea. I'm so sorry, guys. I will get back to you on it. I just don't want to say something wrong and then you guys remember that one. But what was I talking about? Okay, yeah. So adding a hydrogen to my fatty acid chain is not a good thing. I do not want to add hydrogens to my fatty acid chain. So I told you vitamin E means electrons. And so what that means is that vitamin E is making sure that the electrons in my carbons are staying there. The electrons are not being taken up by the hydrogen. The electrons are staying at my carbon. Because they're staying at my carbon, that means that they're staying in this form, polyunsaturated fatty acid form. I do not want hydrogens to steal the electrons from my carbon. So vitamin E electrons means that the electrons stay with the carbon. Exactly. Vitamin E protects polyunsaturated from becoming saturated. Saturated is bad guy. We don't want the saturated one. Good. Okay, if you understand that concept, that is like the hardest one out of this slide. I don't think melting butter will make a difference because the chemical structure is still the same. I don't think so. It's better to opt for something like vegetable oil. You're thinking about it critically though, so I'm glad about that. Okay, yeah. So we went through the hardest one, which is this middle one over here. The first one is the easiest one in my opinion to understand. I don't know if you guys know what free radicals are. They're like these molecules in your body, and they're really unstable, and they just want to steal electrons from like everywhere else. And if they start to steal electrons from everywhere else, for example, if they steal an electron from your red blood cell, they're going to damage those structures. You know what I mean? Like they're stealing the electrons, and because there's these free radicals are stealing the electrons, the other structure that had its electron stolen is going to get damaged. So we do not like free radicals. And that's why I told you, vitamin E, you're going to think electron, and vitamin E is going to prevent free radicals from stealing the electrons. And exactly like somebody says, they make the other structures unstable as well. Free radicals want to get reduced. Yeah. Because they want to gain that electron so that they become more stable. Those are some good questions. So if you guys understand that concept, you should be able to remember vitamin E is an antioxidant because it's going to prevent structures in your body like red blood cells from getting oxidized, right? It's going to prevent the red blood cells from losing an electron from these evil things called free radicals. Okay, and then the last point is, I think a little bit complicated because it's more so like a third year thing, but what you have to understand is that there's these structures in your body that carry fatty acids. Oh, I also have another mnemonic, vitamin E fatty. So that you remember that most of these, 2 out of 3, fatty acids. Okay, that's going to be the other thing that's going to help you remember this. So vitamin E for electron to help you remember all these mechanisms, and vitamin E for fatty acids. But yeah, protects the oxidation of, so pretty much what happens, I have these structures in my body, and they're called low density lipoproteins. They carry fatty acids inside of them, okay? And they pretty much, their job is to make the fatty acids go to like the peripheral of my body. So they're sort of the bad guys. They're adding this like fat to all of like the surrounding tissues, and it's just going everywhere and it's spreading fat everywhere. The low density lipoproteins. The thing is, I do not want these low density lipoproteins to get oxidized. I'm going to show you why in the next slide, I think. This. If my low density lipoproteins, if they get oxidized, that's really bad and that's not good, because if they get oxidized, they're going to form this thing over here, which is called an atherosclerotic plaque. It's a very fancy name, but all it means is a fatty deposition. So I do not want low density lipoproteins to be oxidized, which relates back to vitamin E, electron. It is going to, oxidation is lost. Low density lipoprotein. Yeah, it's going to make sure that my low density lipoprotein keeps its electrons. It's going to prevent the oxidation. Vitamin E, electrons, prevents low density lipoproteins from losing its electrons. Does that make sense? It's going to prevent the oxidation of low density lipoproteins so that I don't get these nasty plaques in my body. That's why it's an antioxidant. Like somebody asked, D and E are the only fat soluble vitamins can we synthesize in the body? If you remember, I said vitamin K is made by the gut bacteria. So to some degree, that is something that's also made in the body. But that's a good question. So these three things are the benefits of having vitamin E. Exactly. The three benefits: if it prevents the oxidation of LDL, so no more fatty plaques. It's going to prevent my free radicals from stealing electrons from like other structures like my RBCs. It's going to prevent my fatty acid from becoming saturated, because if it's saturated, that can also lead to fatty deposition. So these three things over here are the good things about vitamin E. We like this. Does high consumption of saturated fats cause the LDL to get oxidized? I don't know, to be honest. I don't know if there's a linkage between that. My general thought process is more so if you have a high fatty diet, you're going to have increased LDLs. You guys know this from GI, but if you have increased fat diet, you need more LDLs in the body to transport them. And so it's more chance that it will get oxidized. How much longer do you think it will take to finish? Oh, okay. I don't know. I'm sorry. I'll try to go faster, or not faster, but vitamin E prevents oxidation of LDLs. So vitamin E prevents oxidation of LDLs, yes, and it prevents the reduction of free radicals. Yeah. Okay. So we're done with vitamin E, I believe. Vitamin E is less toxic. Yeah, we talked about that. It's a good guy. It's antioxidant. Okay, so I told you the primary deficiencies is kind of rare, and we know why it's rare. It's because everybody likes oils, everybody likes oily food. You're gonna have vitamin E. That's my sort of dumb logic. And then you guys should be able to also like think your way through this. We talked about vitamin E. Vitamin E is going to prevent the free radicals from stealing electrons from other people, right, or from other structures in my body. And the example I kept giving you was red blood cells. Free radicals can steal the electrons from red blood cells and make them unstable. And so if I don't have enough vitamin E, then my free radicals are free to attack my red blood cells, and because of that, I can get, again, hemolytic anemia, which can present as jaundice. Does that make sense? Okay, we are done, in my opinion, with the hard part of the lecture. Now it's the water soluble. Water soluble, you only need to know, okay, it sounds like it's only two. Vitamin B isn't just one vitamin, it's a bunch of vitamins, but it's at least easier. You got through the hard part, guys. Vitamin B complex and vitamin C, those are my water soluble vitamins. I already talked about this in the beginning. Because they're water soluble, they're going to be staying in my blood. It's kind of a bad thing because it's staying in my blood. That means that they are so easily going to go into my urine, and so you're going to constantly be urinating these water soluble vitamins. So I need to replenish water soluble vitamins much more frequently than I need to replenish fat soluble vitamins, because we can't store these. They're water soluble, they stay in your blood. And then coenzymes. Coenzymes are not enzymes, but they help enzymes. They essentially allow for enzymes to act in a faster way to speed up the reaction. Okay, so I already talked about coenzymes, but let's break this down in sort of like a flow chart. I have these things called cofactors. Cofactors is like an umbrella term, okay? And then within cofactors, I have inorganic. Inorganic means it doesn't contain carbon. So I have inorganic cofactors, which are just ions. Like if you think of like Mg2+, copper, iron, those are inorganic. So they obviously don't have carbon. They're just metal ions. And then I have organic cofactors, which are coenzymes, and these contain carbon, and then usually they're like proteins. One other thing is that, like, if you look over here, the difference between an apo enzyme and a holoenzyme, these are kind of like two versions of the same enzyme. So I have this one enzyme over here. If I add a cofactor, it's going to become like the activated version of the enzyme. So the enzyme without the cofactor, I call that apo enzyme. And then if I add the cofactor to it, or if I add the coenzyme to it, I'm going to call the entire structure a holo enzyme. So my holo enzyme is active, my apo enzyme is inactive, because my apo enzyme does not have the necessary cofactor. That's it for cofactors. Okay, so I told you I'm going to break this down to a flowchart, right? So we said the umbrella term is cofactors. And I said I can break down cofactors into inorganic ones, which is ion ones, or I can break them down into organic ones, which is the coenzymes, right? So if I follow the flowchart, and now I'm going into plus or minus of cofactors. Okay, so pretty much if I add a cofactor to, okay, so I have an apo enzyme. Apo enzyme is no cofactor present. Okay, there's no cofactor. Apo enzyme, there's no cofactor, right? If I add the cofactor, this entire thing is now called a holo enzyme. It's the exact same enzyme. It's just that if the enzyme has the cofactor, I call it apo enzyme. And if the enzyme, oh my God, I'm so sorry. If the enzyme has the cofactor, I call it holo enzyme. And if the enzyme doesn't have the cofactor, I call it apo enzyme. Does that make more sense? Whole enzyme, yeah, holo enzyme. Yeah, good. And that's the active form. Okay. Okay, so let's go back to the essential ion. These are ions, so they're obviously usually like metals. And there's within my essential ions, within my inorganic cofactors, I can break it down into 3 more categories, right? And I'm going to tell you how to differentiate these from each other, because just by the definition alone, they do sound a little bit similar. So the first type is activator ions. And if you've noticed over here, I've bolded the word reversibly. And this is what this image over here is. Essentially what an activator ion is going to do is that there's an enzyme over here. My activator ion, which is this orange square over here, is going to bind to the enzyme, and it's going to make it so that the active site is now ready for the substrate, so that now the substrate can bind to the enzyme. Okay, so really key idea here though, this is going to bind reversibly. As soon as this substrate binds, then my activator ion has done its job and it's going to dissociate. It binds reversibly. If you see reversibly in an MCQ, that is a dead giveaway. This is an activator ion. It's not really one of the other ones. Because in contrast, if I have something like metal ion of a metalloenzyme, these are tightly bound and they have a very direct effect. They're so associated with the enzyme. So metal ions of metalloenzymes, I'm talking about the second one now over here, they're tightly bound to my enzyme. If you see tightly bound in an MCQ, that is a dead giveaway. I'm talking about metal ions of metalloenzymes, and they have a direct effect of catalyzing the substrate. So if I took the substrate over here, it would directly break it down, right? If you contrast it to the first one, my activator ion isn't directly acting to my substrate at all. It's just binding to my enzyme reversibly so that my active site can be ready. The second one is a direct effect. Metal ions of metalloenzymes tightly bound, they're going to directly catalyze the reaction. And then the last one are called metal activated enzymes. These ones pretty much don't bind to the enzyme at all. Instead, all we're going to see is that if I add a little bit of metal ions to certain enzymes, their activity is going to go up. So there's nothing to do with binding. If you see binding in an MCQ, you know that you can cross out metal activated enzymes. It has more to do with like activation of like the substrate, for example. And you should see words like activation, stimulated. Those are more metal activated enzymes. So just to recap how to differentiate these activator ions, looking for a keyword like reversibly binds to. Metal ions, metalloenzymes are looking like a keyword of tightly bound and direct catalysis. And the last one, metal activated, you're going to see something like it increases the rate of reaction. It stimulates, it activates, it doesn't really bind. You're not going to see bind really. So hopefully that'll help you differentiate the 3. Okay, so remember the flowchart that I talked about. So the giveaway of metal activated is something like stimulation, increased activation rate, something like that. Yeah, like they're talking about the rates of the chemical reaction. Okay, coenzymes. So let's go back to my flowchart. I have cofactors at the top. I can break down cofactors into inorganic, which I already covered. Those are all those like 3 types of enzymes that I talked about right now. So within inorganic, I have these 3 types. And then cofactors, I also have organic cofactors, which are called coenzymes. And within coenzymes, I have 2 types of coenzymes. And the way that you want to differentiate these coenzymes is similar to what I talked about before. You want to be looking out, do these molecules, do they stay attached to my enzyme, or are they, detaching? So if the coenzyme is detaching from the active site, then that is a dead giveaway that this is a co-substrate. Okay, so if it has the ability to attach and detach to my active site, then that is a co-substrate. In contrast, if it's just a molecule that is firmly attached to my enzyme, it just belongs to that one enzyme, it doesn't go to any other enzyme, that is a prosthetic group. So co-substrates, they can attach and detach from my enzyme. They can actually go to like multiple different enzymes. They're not really like specific or tightly bound to that one enzyme. That is a co-substrate. It can detach and attach. Prosthetic group remains bound to that one enzyme. It's a for lifer. It stays tight with that one enzyme, okay? So that's how you differentiate the 2 types of coenzymes. Okay, these are just like different examples of coenzymes. I don't think anything is too high yield, so I don't really have much to say with this. Okay, yeah, so we're now going to go into specifically like coenzymes that I'm going to get from my vitamins. These are mostly like pretty much my vitamin Bs, right? Like I told you, I have a bunch of different types of vitamin B. Vitamin B is just not one vitamin. I can convert all those different types of vitamin B into coenzymes. And sometimes our bodies can't do this. Sometimes that conversion of the vitamin to the coenzyme can't happen within us. And so we need to eat food or plants that have already converted the vitamin to the coenzyme. I think that's just what she's trying to say over here. But so vitamins can be converted to coenzymes is the main idea. Okay, these are a bunch of different vitamins over here. They have like the vitamin that I might like ingest. And then over here, they have what do I convert each vitamin into? Like what is the coenzyme version of this vitamin? So for example, if I take the first one over here, I have niacin, and I can convert it using whatever enzyme into a coenzyme, which has a different function than the original vitamin. So it's like essentially like this vitamin, I'm literally changing the structure to convert it into a coenzyme, if that makes sense. It'll make more sense when I go through the specific examples. I'm not sure if you guys need to know the specific like B1, B12, whatever, but I did try to look up a mnemonic for you guys, and I altered it a little bit so that it's only the ones that you guys need to know. But it's a little bit silly, but the rhythm nearly proved fairly contagious. The T is for thiamine, for vitamin B1, rhythm, riboflavin, nearly, niacin, proved, pyridoxine, fairly, folate, and then contagious, cobalamin. I'll try to really emphasize this throughout the lecture because I know right now it's just a slide and it's a bunch of numbers, but I'll try to come up with little mnemonics to help you remember. But these are the ones that you need to know. These are all different forms of vitamin B. There's a bunch of different names, but I'll go through these so that it helps you. Okay, so I also, by the way, reorganized the slides so it's in order so that it goes like vitamin B1, B2, B3, etc. So let's start with the first one, vitamin B1. The way that I guess you can remember is that it was the first one discovered. So that's why it's B1, because it was the first one discovered. My mnemonic is once again a little bit weird, but hopefully it will help you. So when you think of vitamin B1 and you're thinking of thiamine, right? We said that vitamin B1 is thiamine. I need you to think of berries. I know that's really random, but when you hear vitamin B1, when you hear thiamine, I just need you in your head right now to visualize a berry in your head, okay? And if you visualize a berry, you will automatically remember the name of the condition that vitamin B1 deficiency is associated with, which is called beriberi, right? So vitamin B1, I need you to think of the fruit berries. And if you think of that, you'll remember the condition, the deficiencies associated with, which is beriberi. If you also remember berries, if you think of vitamin B1 or thiamine, and you're thinking of the fruit, you're thinking of berries, what you can also think of is, okay, what comes from berries? Wine. So if I have wine, then I can remember that vitamin B1 deficiency or thiamine deficiency is also an alcohol-related disorder. So again, I'm starting off vitamin B1, thiamine. I'm like, okay, I don't know anything about this. The only thing I know is that it's the fruit berries. That's the image I have in my head. If I remember the fruit berries, I can remember the condition associated with beriberi, which the patients will come to you very skinny. That's why it says like anorexia. And then some like neurological disorders like confusion. And then if you think of the fruit berries, you're also going to think of alcohol, and because you're thinking of wine. And if you think of wine, you're going to remember that it's an alcohol-related disorder. And then there's one more association with berry and thiamine and vitamin B1, but I'll go into that in a second. Okay, so we talked about how I have vitamins. I have vitamins like my thiamine, my vitamin B1, and I can convert thiamine or vitamin B1 into a coenzyme, like over here. So I think the only thing she just wants to show you over here is that you're literally like just changing the structure of a vitamin and you're making it into a coenzyme. Okay, so remember how I told you there was a third thing that I want to associate with thiamine? And if you remember the fruit berries, you should be able to remember the C. The last thing is keto acids. And I know this is really random, but if you guys remember, I believe you guys have studied type 1 diabetes, and you guys, I think, should know that in type 1 diabetes, they have a fruity odor, right? They have a fruity odor in their breath. And that's because of ketoacidosis. That's because of keto acids. And so if you remember, if you think about it and you're like thiamine, vitamin B1, oh, it's associated with berries. And if you remember berries, you're going to remember, oh my gosh, a fruity breath odor, which is why it's associated with keto acids. That's why the cofactor is associated with keto acids. I know it's really random and it's a stretch, but these are just the ones that I come up with. So those are the three things that you should be aware of with thiamine. You should be aware it's associated with, actually, I'll show you the next slide. Those are the three things that you should be aware of for thiamine or vitamin B1. It's associated with beriberi. This is what it looks like. Anorexia, confusion, heart problems. This is beriberi, thiamine deficiency. If you think of berries, you're also going to think of wine. And so you're going to remember it's an alcohol-associated condition. And if you remember berries, you're also going to think of a fruity breath odor. And if you remember fruity breath odor, you're going to remember that the cofactor is associated with keto acids, because keto acids or ketoacidosis is what causes fruity breath. So hopefully that helps. That's a little bit weird. Okay, the rest of these I think are a little bit simpler, but the other, actually no. Okay, so for riboflavin is vitamin B2, and the way that I remember this is that there are two things I need to remember with riboflavin. I need to remember associated with retardation and reproductive problems. And this makes it even easier because both of these things start with R: retardation, reproductive problems, riboflavin, which is vitamin B2, because retardation and reproductive problems are just two things, so vitamin B2. So that's how you're going to remember that. I know over here it says neurodegeneration, but in my opinion, neurodegeneration and retardation are the same thing, or they present very similarly. And then this part over here, this flavin part, is what's going to be converted to make the cofactor, the essential cofactor. Okay, that's sort of the it for riboflavin. Riboflavin, so then R, retardation, reproductive problems, B2, two things I need to remember: retardation, reproductive problems. Okay, now we're on vitamin B3, which is called niacin. Again, I just use the same thing that I used before, where vitamin B3, there are three things I need to remember: dermatitis, diarrhea, and dementia. These three symptoms presented together are called this pellagra. So pretty much like pellagra, if somebody's coming with like some sort of like skin itchiness plus diarrhea plus, let's say, like confusion, like let's say a clinical scenario is like that, like the patient's having skin itchiness, they're having diarrhea, and they're coming with like forgetfulness, then that will make you think of pellagra, and then you should be able to be like, okay, these are three things: dermatitis, diarrhea, dementia, vitamin B3, which is also called niacin. And then you guys should also be aware that you can make niacin from an amino acid in your body called tryptophan. So tryptophan can be converted into niacin, and then niacin can be converted into this cofactor called NAD plus or NADP plus. So pretty much like niacin can be converted into either one of these. Hopefully, to help you remember, niacin can be converted to NAD plus, NADP plus. Maybe I'll help you remember niacin and like what cofactor it's associated with. I feel like this slide sounds kind of confusing, but in case you guys ever forget what enzyme is associated with NAD or NADP, what you guys can remember is that the initial form of this is actually NADH. And so I need to use an enzyme called a dehydrogenase to remove the hydrogen. So essentially, maybe I can draw it, but it's like, I can't draw. But I'm like, what's happening is that I have NADH and I use a dehydrogenase to remove the hydrogen to convert it to NAD plus. And so if you ever come confused and you're like, what is the enzyme associated with NAD plus? As long as you remember that the initial form of NAD plus is NADH, you'll be able to remember, oh my gosh, H for hydrogen, and I need to remove the hydrogen to make it into NAD plus. So the enzyme associated with NAD plus is dehydrogenase. That should help you remember. And pretty much when you're converting like the NADH to this form over here, you're giving 2 electrons, not 1. And then the way that I differentiate between NADH and NADPH, this is something that my high school teacher used to tell me, but it's like NADPH. This isn't true, but you can think of the P as plant. And if you think of biosynthetic, that literally means like making organic like molecules, which humans don't really do. It's mostly plants that make organic molecules. So it should kind of help you remember that P will remind you of plants. Plants will make you think, okay, it has to be something biosynthetic. These are plants can make, organic molecules. Humans can't, not really. And then NADH, and then just by process of elimination, you'll be able to get that NADH is the one in the mitochondria. It's the one that's like in humans. For vitamin B5, the way that I remember this is that pantothenic kind of sounds like pentagon. Pentagon has 5 sides, and so I can remember that it's vitamin B5. If I convert vitamin B5, I can get this structure over here called coenzyme A. I believe you guys pretty much already know what coenzyme A is. You use coenzyme A to like make acetylcholine. So it kind of makes sense. Like you can literally get it from the name. Like it's like I have coenzyme A. From coenzyme A, I can kind of make like acetyl-CoA, or it can be added to make acetyl-CoA. From acetyl-CoA, it sounds a lot like acetylcholine. So you should just understand that these things are related. Like vitamin B5, if you remember vitamin B5, coenzyme A will make you think of acetyl-CoA, and then from acetyl-CoA, you should be able to understand that acetyl-CoA is necessary to make acetylcholine. They even sound similar, so it shouldn't be too hard to remember. And pantothenic, B5, pentagon, pantothenic. That's how I would memorize it. I don't think this is the last one, but vitamin B6 is called pyridoxal. I tried to think of a mnemonic for this one. I really can't. But just be aware of the fact that if you ever see anything of this derivative, pyridoxal, you just should be thinking of the vitamin B6 group. And then this is just like the cofactor version. So again, if I convert vitamin B6, I can convert it to a cofactor. And the name of the cofactor is called pyridoxal phosphate. I don't think there's anything necessarily like high yield on this. Okay. Yeah. Okay. Somebody said it has an X and a hexagon. Hexagon has a 6 sides, so maybe that can help you remember vitamin B6. That's a good one. And then just remember the cofactor version is pyridoxal phosphate. And then, okay, so I told you I was going in order. So we went from vitamin B6 and now we're on vitamin B9. You guys probably already know vitamin B9 because I know you guys know folate acid deficiency, or I think you guys know folate acid deficiency because in embryology, I believe you guys learned that if you don't have, if you don't give, this doesn't always happen, by the way, but there is an increased chance that if you don't give a pregnant woman folic acid, she might get neural tube defects. Pyridoxal phosphate is the cofactor version of vitamin B6. Exactly. Yeah. So you guys already know this. The way that I remember folate is B9 is a little bit weird, but what I think of is that B9 kind of sounds like benign, like something that's like not really problematic. And the way that I remember that is that in the vast majority of pregnancies, if you don't give them folic acid, nothing's going to happen. But there is that like 1% that if they have folic acid deficiency and you did not give them folic acid, then they're going to have the neural tube defect. Or 9 months of pregnancy. It's probably a lot better. Yeah, so folate is B9 because of 9 months of pregnancy, and that should help you remember that you want to prevent neural tube defects. So you give this during pregnancy. Usually you just give it like in foods, like you just add a little bit of like folic acid. Yeah, specifically the neural tube defect is called spina bifida. And then the coenzyme version of folate is just called tetrahydrofolate. You can just get it from the name. It has 4 hydrogens, literally tetrahydro. So I think that one's pretty straightforward. But just remember it's vitamin B9 because 9 months of pregnancy for folate. Okay, and then something you guys should be aware of is that like cobalamin and folate are very closely tied to each other. They both play a very strong role in like DNA, like with DNA synthesis. Okay, so you should be, so the reason I'm bringing that up is that a lot of the time when you test for folate acid deficiency, you also actually test for cobalamin deficiency. So you should be aware that these two are like sort of like associated with each other. And then I just told you that both of these play a role in like DNA synthesis, and that should help you remember that they play a role with ribonucleotides and deoxyribonucleotides, because these are things that are very, very essential for DNA synthesis. So cobalamin, what I want you to remember is that it's, oh my God, okay, I'm almost done, I promise. Okay, it's literally the last slide. It's literally so simple. Biotin is water soluble, like I said, which is that it's not, the deficiency isn't really significant. If you eat 6 raw eggs, yes, you can get a deficiency. I don't know who would eat 6 raw eggs, but you should know that, 6 raw eggs have avidin, which can interfere with the biotin. Okay, as one last quiz, and then I believe we're done, which is that if you, so over here it says that biotin is produced by gut microflora, and I have a quiz for you over here, which is what other vitamin is also made by gut microflora. Why 6 raw eggs? Specifically, I have no idea. I think that's just random. Okay, biotin has a cofactor. It's literally called biotin cofactor. I don't think there's anything particularly high yield with this. And then very last thing, vitamin C is associated with scurvy. The way that I remember this, vitamin C is a curvy letter. It literally looks like a curve. And so curve will make me think of scurvy. Scurvy is like this thing over here. It's like abnormal collagen formation. And so they're going to have like lots of teeth, for example. So vitamin C and scurvy. That's the main thing that I think you should be aware of. And then it's associated with collagen. Vitamin C, C for collagen. If I don't have collagen in my gums, it's going to make me lose my teeth. And that's called scurvy. Oh, and it's an antioxidant. Do you remember what other vitamin I also told you was an antioxidant? E for electron. Yes, common in sailors, old times, yeah. Vitamin E, yes, it's also an antioxidant. Okay, I'm finally done. I'm so sorry. I went really over time. Hopefully that helped and hopefully that was useful. Mostly with the fat soluble vitamins because I think the water soluble are more straightforward. But okay, thank you guys for sitting with me. Hopefully you get a break before your next one. Okay, yeah, we can end the session.